So today it's my pleasure to introduce Argentina's Servin, the use of CBPR for addressing vaccine hesitancy among Latinx and Black communities is in Southern California. She's an assistant professor in the Division of Infectious Diseases and Global Public Health and a good friend and colleague of mine. And she's also the director of the BS program in public health at the Herbert Wertheim School of Public Health and Human Longevity Science here at UCSD. She is bilingual and bicultural clinician researcher trained in preventive medicine, infectious diseases, and clinical epidemiology. Her work has included assessing sexual and reproductive health, education, gender-based violence, and intersections with HIV and STI risk and prevention. And that's where we've seen a lot of her work, including also health service utilization among vulnerable, underserved populations, including female sex workers, adolescents, at-risk youth, migrants, and refugees in both domestic and international settings, which she's going to talk about a little bit today. And then she has a strong interest in improving the health of medically underserved communities by developing and implementing and evaluating clinic and community-based behavioral interventions centered on linkage to care and reducing barriers to care in under-resourced settings. So that is great. So I really look forward to it. And thank you for joining us today in our last talk from Prepare. So I'm going to turn it over to you now.
Oh, thank you for having me. I didn't know it was the last one.
Well, for the year.
For the year. Okay, that's exciting. Well, I hope to keep you guys entertained. So let me share my screen. Oops. Okay, there you go. Okay, so, oops, where am I? There you go. You guys can see that, right?
Yep, looks good.
Okay, great. Thank you. So Davey already introduced me. Thank you so much. And I'm going to talk about the use of CBPR for addressing COVID-19 vaccine hesitancy among Latinx and Black communities in Southern California. So I feel like everybody knows this now, 2 years into the pandemic. But at the beginning of the pandemic, we saw that Latinx and African-American individuals were being more impacted by COVID-19. Basically, they were killing us, right? So what we saw is that there is no genetic predisposition among people of color for COVID-19. It just had to do with these existing disparities experienced across the country, right? We are, more likely to not have to be uninsured. We were the ones that were, working at the grocery, those bus drivers really kind of constantly being exposed. We tend to live in more high density and multi-generational households. And we also tend to have more pre-existing conditions, which all of these factors, as we already know, were placing us at higher risk. When the vaccine was developed, which the anniversary is coming back this Sunday, we saw that African-American and Hispanics were less likely or more unwilling or more hesitant to obtain the COVID-19 vaccine. And so while things have shifted and there is less hesitancy among, Black and Latinx communities, there still is some hesitancy. What we're seeing more right now is hesitancy towards getting the bivalent booster, and I'll get more into those details. So this is December. I'm just going to tell you guys kind of the story and what happened. So this is around December 18th, and a notice of special interest came from NIMHD. And I remember I actually reached out to Davey and I said, Davey, I have an idea. And I said, can we do this? And he was like, nope. First, I wanted to go door to door with the nurses, right? I was looking at previous interventions done in other jurisdictions, like some work done in New York City where they did influenza door to door. It's like, nope, we don't have enough nurses. I was like, okay, Davey, can we do this? So we went back and forth with the idea of how could we go out into the community and to really meet, specifically working with Latinx and Black communities, how can we meet them where they're at? And there was also a lot of misinformation happening at that time. So we got together with folks at San Ysidro Health, who are community partners here, and they already had some preliminary data. They had been doing some formative research and had identified some community leaders in the African-American, Black, and Latino community that we could work with to try and figure out how can we address the needs of our community. So this is our team. It really takes a whole village. I'm extremely grateful and thankful for everyone who has been part of this project, from our undergraduate students here at UC San Diego to our co-Is like Davey and other amazing colleagues here in our division, as well as our community partners and the community advisory board that we've been working with. And all of these small businesses that you see here have supported our pop-ups for the past 2 years. So we're extremely grateful for everyone's support. It really does take a village. I'm here just speaking on behalf of everyone. So along came Project Tu Vida. It's a multi-level intervention focused on addressing individual and structural barriers to accessing the COVID-19 vaccine, as well as addressing COVID-19 health misinformation. So these are our study objectives, and this is kind of where we're working on and our study design. So the first phase focused purely on COVID-19 awareness and education materials, on COVID-19 community outreach and health promotion, and then COVID-19 individual health education and linkages to medical and supportive services. And then phase 2 provided the vaccine at these community pop-up clinics, which were our intervention sites. And we're working in San Isidro, Chula Vista, National City, Valencia Park, Logan Heights, and Lincoln Park. So this image that you see here is from the first year of the pandemic. Those are the zip codes where we have the highest number of cases, and there are more predominantly, Latino and Black communities. So that's where we targeted our efforts and where our intervention was focused on. I will say something that this is kind of lessons learned, right? What we're presenting here, something that has been really interesting is that our community members are really interested in printout educational materials. We really went door to door inviting them to the events and to town halls and to community engagement forums that we were doing, and they were really interested and actually joined and participated in these different sessions. And I'll get more into those details, but it was really surprising hearing from the community that they wanted to see things printed and read, even though a lot of people be able to read them, and even though most people you would think we're in a digital era, but people really wanted a lot of those flyers and handouts to kind of have printed. So as far as those educational materials, obviously things have changed a lot. So, if you can see here, this was from last year. What was Florona? What's a primary series? So a lot of information as the CDC was releasing, or the WHO releasing this data, we were trying to tailor it down to ensure that it was culturally appropriate and also at a literacy level that anybody could understand. So we do have our study website, and we do have our social media. We have an Instagram and Facebook page, and we have actually gotten lots of requests directly to our Instagram for requesting pop-ups throughout the course of these 2 years. Obviously, we have to make sure that those requests do align with the study objectives. So the ones that we haven't been able to or didn't align the study settings or was outside of our study design, we're fortunate enough to connect them to other colleagues at UC San Diego that, for example, the Center for Community Health and Pediatrics, that they're doing work with the refugee community in their mobile units. So those are some examples of cross collaborations and partnerships, or even going back to the county with whom we also have a really great relationship, and we're thankful for their support and trying to do those linkages for our community members. So these are other examples. Obviously, these things have changed a lot since then, but this is when we had the Delta variant. We talk about Omicron. So we've distributed around 20,000 educational materials in both languages. Our reels, our reels specifically get about 10,000 views or more. And as I mentioned, they've been directly reaching out through it. And obviously this is targeting Latinx and Black communities through post and advertising. And we've developed more than 40 educational materials and resources for community members, both in English and Spanish, that have spanned 2 years. As I mentioned, we did a lot of canvassing door to door to small businesses and housing units throughout these intervention sites, providing the educational materials and also advertising our pop-up clinics. We also hosted approximately, I remember for the month of October and November this time last year, we hosted every Friday 2 sessions per day for what we called community engagement forums, through partnerships, through different faith-based organizations, where we basically kind of talked about the basics, like 101, what's the vaccine, how was it developed, and then which our project managers would present. And then we had like a little Q&A of like talk to the experts, meet the experts, where we had different physicians and as well as my from San Ysidro Health, as well as myself as PI, kind of coming at the end and being like a quick Q&A, which the community members really, really appreciated. I think something that has been critical is the fact that we don't want to force anyone to do something that they don't want to do. Our focus is on educating, really going back to the basics, on educating our community members so they can make an informed decision, but they can't make an informed decision if they don't have these tools. And then something very unique about this project is that thanks to the partnership with San Ysidro Health, we have been able to provide linkages to medical and supportive services. So through these mobile pop-up clinics, we do blood pressure screenings, glucose screenings, COVID-19 tests. Even at the time where you couldn't find a test, if someone remembers last year during the surge that we had in around Thanksgiving and Christmas, around the holidays, HIV, STI testing, we have free provider visits, behavioral health. We also have partners with local food banks and transportation services. I think something that has also been evidenced by the pandemic is that our community has different needs. It's not only related to COVID-19, or yes, because of COVID-19, let me rephrase that, because of COVID-19, they've had other needs. Lots of folks lost their job. Lots of folks didn't have, money to pay for rent, to pay for food, for other services. So coming in with a more holistic approach and being able to provide linkage to other services at no cost has been really, really great to be able to do it through this work in these partnerships. So far, what our community pop-up clinics look like. Obviously, we're trying to provide these vaccines to hard to reach Latinx and Black adults by offering these vaccines in community locations. So we definitely do. We were providing it out of the regular office hours because we recognize that sometimes, our community members are not able to go within a regular schedule because they maybe work 2-3 shifts, right? We also were basically on weekends and out of regular office hours. We also didn't ask for any identifying information of Social Security, for example, which that was a barrier, especially in this region where we have a lot of individuals that might have a mixed migration status at home. If you guys recall, in order to make an appointment to get the vaccine, you had to enter personal information such as a full name, address, a Social Security number. So we would just ask for a first name, email, address, and date of birth, because we do have to enter them in the system for the California Health Department. But they felt very comfortable because we weren't asking for any additional identifying information. We also, as I mentioned, we focus a lot on providing reliable information to hesitant community members, both in English and Spanish. The fact that we always had a bilingual nurse or staff on site or PA or physician was very, very helpful. I definitely heard more than once, folks telling me on a pop-up, it's so nice to hear information in my language. It's so nice to hear someone, talking to me a way that I understand. They also mentioned it was really nice to see someone that looked like them as well, kind of providing guidance and care. Obviously, we continue to promote testing for early detection, and we do have PPE kits that are handed out. And since July 7, 2021, which was our first pop-up, we've done 88 pop-up clinics. We've administered close to over 1,700 vaccines. We have 903 participants enrolled, so we're getting close to wrapping up data collection, and we linked individuals to over 4,000 services. So it's been a really unique experience and a really amazing work. And I'll talk more about it later as far as our next steps. As far as preliminary findings, these are just basic descriptive statistics. We are working on other analyses that I'm happy to share later. But basically our population, our mean age is 47 years old. A little bit over half had equal or less than high school education, and close to half were also married or living with a partner. 45% reported an average household income of below the federal poverty line. And we had about 38% that identified as male, 59% as female, and 3% as genderqueer or non-binary transgender. As far as race and ethnicity, 87% of our sample identified as Hispanic, Latino, or Latinx, and 6.4% African-American or Black. I know these numbers don't look ideal, but this does mirror the racial and ethnic composition of San Diego County. 55 reported being employed, 45% reported having a government-sponsored insurance, and 27% reported having no insurance. So we did ask about certain vulnerability factors, such as experience unstable housing, having financial issues, or experiencing IPV. So 34% reported not having enough money to pay for rent, and 7.5% not enough money to pay for food, and 14% reported other financial challenges. I will say that we were very surprised that only 3% reported IPV. I do think that we need to work more on building that trust and relationship with the community in the sense how they feel about disclosing these issues, just because we know that there was actually an increase in IPV during the pandemic. And 66% reported pre-existing conditions. The most common ones were hypertension, type 2 diabetes, overweight or obesity, arthritis, and mental health, such as depression and anxiety. I do believe that these are very likely underreported because it is self-reported. So if they're not in regular care or haven't been diagnosed, then they were more likely to not respond to that or report that they're healthy. Oh, I forgot to mention, sorry. All the photos that you see here, I'm so sorry. All the photos that you see on the presentation are actually from our work in the community. And we do have permission to use these pictures. And I think you guys might see a familiar faces here on this picture, which is part of our colleagues and co-Is from San Ysidro Health. So something that's from the information collected is that about 80% reported that healthcare workers were a source of information for COVID-19. And they also reported that they trusted more healthcare workers as a source of information compared to the CDC, WHO, or other organizations or institutions. So I think that, I was thinking about this, I'm like, well, we have a great deal of responsibility. Especially because we did, as you all recall, there's a huge anti-vax movement, and there were a lot of licensed physicians in our country that were using social media platforms to spread misinformation or their personal conceptions with no scientific data to back up about the safety of the vaccine. So I think that really stresses the important role that we play in the health of our community members. They trust us. And then also thinking about training, right? A lot of you here, have medical students or public health students. I think it also stresses the importance of, how do we train the next generation? Like, how do we, on talking to your patients, how do we talk to our community so they understand us, so they know how to stay healthy and take care of each other? How do we build those patient-provider relationships, right? And then we also found that 51% reported using social media as a source of information, which is not surprising. It also spreads a lot of misinformation. 21% reported that it was difficult or very difficult to judge if the information about COVID-19 was reliable. As you'll recall, when the CDC came out with the information about when do you isolate yourself or when do you quarantine, it was extremely confusing for community members. We definitely got lots of questions about that. And then 52% of participants reported to being concerned about the side effects of the vaccine. So as far as best practices, what have we learned so far? We learned that it's really important to address hesitancies and concerns, as I mentioned before, with a non-judgmental and compassionate environment. As I said, we're not forcing anyone. We're just here to provide the resources and the information they need so they can make an informed decision. This work has really been about meeting the community where they're at and understanding their needs. The important role of the promotoras, the door-to-door efforts, the canvassing, the setting up a tent a couple of days before our pop-up clinic, having free swag, trying to get people to come to see what this was up, trying to come to these engagement forums, engagement sessions, the importance of partnering with local community leaders and businesses. It has been more difficult building a relationship with the Black and African American community in San Diego that it has been with the Latino Hispanic community here in San Diego. I'm very, very fortunate to work with the Multicultural Health Foundation and with Miss Cynthia James Price, who is a prominent leader in the Black community here. And she's been amazing, a partner, helping us identify venues, promoting events, promoting the uptake of the vaccine, doing these virtual forums with different faith-based organizations, barbershops, coffee shops. So it has been really difficult, but we're extremely thankful of these partnerships and these community members really coming out, trying to see how they can better serve the community because they were concerned of the numbers and the data, right? And then the importance of personalized care. Our participants know us on a first name basis. It has been really, really critical for the follow-up and completion of their vaccination series and booster as well. So as far as for future directions, so this needs to be updated as far as it's probably a little bit more than 9% now. This is from about, I believe, 2 weeks ago. But I am a parent. I was 6 months pregnant when the pandemic was declared, and my son only until recently over the summer had access to the vaccine. So I know that the conversation is shifting more from a pandemic to an endemic state, but I do think that we do be very mindful and not forget about our children. We do have a grant in our 21 under review. It was just scored. It didn't score as good as we thought it would be. So I do have a meeting with PO in the next couple of weeks to kind of figure out what will be the next steps with that work. There is a huge gap between COVID-19 vaccination coverage between urban and rural areas. It has doubled since April of last year. And so we're also trying to work on foundation opportunities to kind of bridge that gap and work on that as well. And then building on the existing to the infrastructure. So we think that there's definitely opportunities to build on the lessons learned, on the infrastructure and partnerships that we've established through this work centered on COVID-19 to transition to decrease the burden, of other preventable infections such as monkeypox, HPV, influenza, etc. We actually do have a grant under review at NIH focused on actually addressing hypertension among Black communities and really providing those resources and linkage into care. So we'll see if they're interested in that. And I also think a lot of you here do work globally. So I do feel like we can't forget about the rest of the world. We still need to work on vaccine equity globally, right? If you look at vaccination rates, across other low and middle income countries, they're not as high. And this is actually a comment that a couple of weeks ago that one of the study participants made at a pop-up, and I was like, wow, even she's conscious about, people are so conscious about it these days. She made a comment that she felt kind of guilty that she was getting her booster, but then people in other places, even as close as Mexico, don't even have the first series completion. And how fortunate she was to be able to have access to these services, which is these services, which is I think it's something that we tend to take for granted sometimes. Okay, so I really want to thank our team, our community partners, and I call it a team because it's a team of as academic and non-academic and community members. So it's a huge, big group that makes this work possible. Obviously, I'm thankful for our participants, our funders, and IMHD. I also want to acknowledge something really, really quick. This work has allowed the training opportunities for underrepresented minorities in the sciences. So this has helped train about 10, 15 undergraduate research assistants that are all first generation that are interested in going into the biomedical field. It also has provided training for postdoc, for a medical student, for all our, we have flying SAMs that we work with at UCSD, and as well as PI. Thank you so much. Here's my contact information. And I don't know if you guys have any questions. Oh, that was too fast. Sorry. Oh, I just saw.
Thank you. That was great. So we have time for questions if anybody has any. There was one good question
Oh,
that was in the chat real
oh,
quickly.
sorry, community-based participatory research.
Yeah.
Sorry about that. Richard, I apologize, Richard. I couldn't see the comments. I was just kind of talking
Argentina,
aloud.
I have a question. So what was the actual ratio of promotoras to the clinical healthcare workers?
We had more promotoras than
You did.
community healthcare workers. Yeah, so we partnered with the group. It's called Mi Universidad. If you're ever interested in working with them, I'm very happy to connect you with them. They're actually they work out of Escondido, but they have a very different approach. So as I mentioned, they basically, and I had never done this before, and even as a trainee with other great folks that do CBPR like Dr. Zuniga, and it was not only the door-to-door, but it's literally setting up tents around the park or community center that's close to that intervention site where we're going to have our pop-up clinic, and kind of going out a Friday at 6 p.m. being like, hey, here we are, and having people come to us because we had a lot of free swag and merchandise. So, the bottles, recyclable bags, and be like, hey, we're going to be here tomorrow. We're going to be offering the vaccine, or we're going to be offering, because there was a lot of hesitancy. We talked more about comprehensive free services being offered.
Mhm.
That was really, really key. We did have lots of people, especially like when we were outside of Northgate and the grocery stores and whatnot, were like, oh, hey, I saw a mobile unit. Are you guys have any blood pressure screenings? Yes, we do. And hey, so as we're talking to him, so have you gotten the vaccine yet? And yes, no, why? What are your concerns? Oh, actually, we have a nurse here. She can talk to you to help you with those, concerns. But I want to say we had how many promotoras? We had at least 20 that would work with us for every single event that we had promoting
Wow.
it. Yeah, it was a lot of work, but they're really, really great. I think something that's also important is that we're working right now on how to make this sustainable. So San Isidro Health has actually committed to continue to offer community pop-up clinics at these different locations. Perhaps not as frequent as we were doing it, but at least once every 2 months to not completely leave the community.
Mhm.
And we are trying to look for other funding to, build on this and these relationships for other diseases, other comorbidities. But yeah, they are committed to doing that, which we are extremely grateful and thankful for.
That's great. And it's great that you had such an effective collaborator. I mean, I've done plenty of community outreach work, and to hear that they set up days in advance to draw an audience is really impressive.
It is, and I was rushing around to Office Depot to get handouts and printouts, and the flying summons camp with us and going knocking on door to door. I will say something I forgot to mention, and I know that I think Stephen has another question. Obviously, the rate has changed a lot. So for during the first year and probably up until this summer, we had pop-ups 3 to 4 times a week. So right now it's more, we're doing it once a week, once every 2 weeks, but we return to the same location. So those same businesses that I mentioned, because they're in the same sites. And we did get approval from the PO at MHD to offer the booster and be able to collect more data, right? Because, something that has been a common theme during this pandemic is that everything is constantly changing. And so they did allow for us to do these changes.
That's great.
Yeah. Thank you, Stephen. Yeah.
Hi.
Hi.
Yeah, very excellent work. Couple questions. So the 900 persons surveyed, this is basically a convenience sample. Is that correct?
Yes, so we compared the pop-up clinics and the intervention, which is the 3 components that I mentioned about individual awareness, educational linkages into care. We're comparing it to the standard of care. So we're collecting data from the control sites are basically the San Isidro Health clinics that are located in these communities, but the radius is far enough that we're hoping that helps to account for some contamination. But yes, it is a convenient sample. It's people who we're targeting and are coming on their own to these clinics and sites.
Yeah. Excuse me, a couple other quick questions while I'm talking. Were you able to get at some of the reasons for vaccine hesitancy in this group? Was it just side effects, or was it concerns that the vaccines weren't effective? Lots of possibilities.
All of the above. So the concerns, about half was concerned about the side effects of the vaccine. There was a strong belief that if you got COVID, then you didn't need to get vaccinated. Obviously, these beliefs have also, and somebody else is looking at that right now, so I don't know exactly the numbers or where the data is at for that, but somebody's looking at differences through time, because it is 2 years of data collection and information has changed and perceptions have changed through that time. What we noticed that impacted us a lot, and there was a lot of concerns, was when the CDC changed, when the breakthrough cases started appearing. There was this idea that the vaccine was not effective, because then why are people still getting affected? But people were not seeing the bigger picture, that our mortality and hospitalization rates had dropped drastically. But there was definitely that. Other ideas, and this is interesting actually, because this came from the Community Advisory Board. We actually did not enroll any pregnant women in our study, because there was a negative perception that we would be forcing pregnant women to get vaccinated against something that was not safe. We know that the data says otherwise, but that's also something that I want to put out there as part of concerns. There's a lot of religious concerns that people also came out or expressed, because we did have some options for people to fill out other, and the other did have to do with really religious beliefs. We did get yelled at, or some folks got kind of aggressive at some of our pop-ups, telling us that we were doing the work of the devil and that we were like hurting people. Yes, that did happen. And it happened more than once. And so even though I didn't say, hey, here's the COVID vaccine, but we did get that as well. And so other beliefs were that it wasn't effective, that we had the breakthrough because we started seeing breakthrough cases. There was a loss of credibility on what the CDC was saying, because they changed their guidelines so much. And we did see, though, on the flip side, that when we saw during the Delta variant, we saw a more uptake on the vaccine, and then it dropped with Omicron, if that makes any sense.
Yeah, I was going to ask also about Omicron, what the community is, how they're responding to that compared to the rest of the population.
Yeah, so we definitely saw less interest and uptake in the vaccine, because the virus is less harmful now. Or that they were fine because they've already had 2-3 infections and they were okay with that, with the symptoms that they presented. The other thing I was going to mention, we do have a lot of hesitancy right now with getting the booster. The community strongly believes that it's only for those that have pre-existing conditions, that it's only those that are over age 65 or older. And so it's been very difficult getting people to get the booster. That even though the data indicates that the booster offers more protection against Omicron variants. So that we have been definitely facing. So we are working on approaches to addressing that. If you have any ideas, we're open to that. We have been trying to tailor down the publications that have come out that actually say that the new vaccine is more effective. Yeah, that's about all I can think of right now. Sorry.
Yeah, thanks. As a CDC affiliated person, I'm interested to hear your comments.
Oh my God,
that.
I didn't know. Yeah, so
true.
So in all honesty, when the isolation, and that's the one I can think of because it just kept on coming constantly, when there was the recommendations between when do you isolate and when do you quarantine, and the reverse breakthrough cases, and when the data came out, if you recall, that I think it spilled through the media, that we knew that Delta was more aggressive and that we would have breakthrough cases and whatnot. So again, Delta surge, we saw an increase in interest, less hesitancy. But then as that information started coming out, there was definitely a lot of more mistrust and a lot of more hesitancy on not wanting to get the vaccine because of the belief that it wasn't effective anymore. I mean, I think that something that I always say when we're at these pop-ups, I remind people that this is the first time we've had a pandemic in over 100 years, that it's a virus that we didn't know a lot about information. And that's why we encourage them to participate in the study and other studies that are happening around COVID-19, because I always tell them the more that you tell us how you felt, what symptoms you had, or the reasons why you want to get, the more you help us understand what's happening. So I think that's something that maybe we could have done better with our messaging and kind of saying, this is the novel coronavirus. We are learning as we go, right? As more data becomes available, we can provide that information. It's not that, you know, we're going back on what we said before. It's just that now we have more information to be able to give you a better an update, and then you can make that informed decision. But I think that that's really, I think, what's been key or would work best. Any other questions?
So, Argentina, did you integrate MPOX into this work as well? And how did that go?
No, we didn't. Sorry, I wasn't clear of that. We're working on a grant that would do a similar model of the CBR approach, working with the Homeless Coalition here in San Diego to kind of provide these mobile pop-up clinics with educational materials, testing, and the vaccine with the people who experience homelessness here in San Diego, which is really interesting. I know MPOX cases have wound down, but 55, even though San Diego is only about 5 to 6% Black, 55% of the homeless population in San Diego is actually Black. So that's huge. I didn't know until I started looking at this data and trying to figure out how we could put a grant together. So that's what we're working on.
Okay, great.
I had a lower level question. You mentioned that people really wanted their sorry about the background noise, get a little one here. That people really wanted.
No worries, got my monitor here.
People really wanted printouts of things, flyers and everything.
Yes.
Did you get into anything about why? Is it like so they could remember what the details were or share it with their families?
A lot of people wanted to share it with their families, and a lot of the small local businesses would actually help us hand them out. Obviously, there were people that said, we want nothing to do with you. Yes, there was that, but it was more of actually the small local business owners that were really, really open to us, like Northgate, like all the money exchange sites across San Isidro Boulevard, grocery outlet. They even gave us like free water to hand out and other stuff. They were more supportive. And so they would actually ask for those for their customers, for family members to actually hand them out. And especially because it was a very fast turnaround. So as soon as information came out, we would immediately work on tailoring it down, sharing it to our community, board, and they would be like, change this, change that, and then it would go into print. So it was a very fast turnaround. Sometimes we had to backtrack what we had said because things had changed, but it's okay. We're going to pick up, whatever was left of those flyers and hand them out. But they were very, very interested in that. And I will say, I actually presented at MPH. And another group of folks that were working out from Georgia had a very similar experience, except they did actually exactly the same thing we did, but with more funding in a shorter time frame. They got $5 million to spend in 6 months, which I think is amazing. Yeah, but it's like to be on steroids. They did it very similar. And we actually stayed and talked, and we have a meeting in a couple of weeks to kind of figure out if there's anything else we can work on together. They were working in a predominantly Black community, but they found very similar findings. People wanted handouts. They wanted printed educational materials to read, even though you can access anything on your phone. They really wanted those materials. They also really appreciated the same approach of having other services, and that being a segue to then introducing them to, oh, hey, have you gotten the vaccine, and opening up that conversation. So that was actually really, really interesting, that we're working on different parts of the country, but had very, very similar findings and a similar approach as far as the door-to-door, the canvassing. They didn't follow our promotores model. Theirs was a little bit different, but they did do, canvassing door-to-door in these mobile pop-up clinics as well.
That's really cool. And you mentioned the broader services part. Were the broader services and other like pandemic related education included in those handouts and things, or were they just
Yes.
focused on that? Okay,
Yes,
cool.
yes. So we provide a lot of mental health through our partnership with San Isidro Health. They always had their mental health and behavioral services unit come out with us. And they would actually really take and they're very seasoned and experienced. So they really would take the time to talk to individuals, to do any counseling, to figure out if they were eligible for any government sponsored insurance, and trying to really link them into care. We also, a part of those resources, we have a COVID-19 resource call center as part of the intervention. And we actually still get calls. Maybe they don't want to vaccinate themselves, but they were part of our study and they want to figure out how can I get my mom vaccinated because she needs the vaccine. Even right now, it's a little bit hard to get you still need to get an appointment. And that kind of becomes a problem where people are trying to, go to CVS and you can't just walk in. Just last week, I made 2 appointments for some of our participants. Or actually, no, they wanted to make an appointment. They walked in, even though they had met the age, they didn't have any spaces. So then we filtered them to our pop-up that we had on Friday. So we just had one this Friday. Yeah.
That's great. Thank you.
Yes, of course.
Argentina, I have a question. I was wondering, so given that flu vaccination rates in San Diego are roughly at around 25%, I'm wondering what lessons or what approaches can be adapted from kind of the work that you've been doing to flu vaccination.
So it's a great question, which I probably don't have the answer for. I think others here might know, but no, so what we've been focusing on right now, and the educational materials that we're giving away right now, we actually are offering the flu vaccine right now. Again, because of our partnership with San Isidro Health, they've been amazing. We actually did a turkey drive a week before Thanksgiving, and we vaccinated about 50. Not all of them were eligible for the study, but we offered the vaccine to everyone, about 50 to 60 people that were over the age of 65, which I think is great, both the bivalent and the flu. So what we've been working a lot on our messaging right now is that we've been informing the community that we're seeing an increase, not an increase in cases, but more severe infection for, as you all know here, for RSV, flu, and COVID-19. So we're really kind of focusing on educating the community on that piece. There's a lot of misinformation right now that, and I'm sure you guys know about this already, that we heard people saying that because we've been wearing a mask for 2 years, it's weakened our immune system. And that's why we're getting all sick. And so we're really working right now, kind of pushing the message that that's not the case, the data shows that COVID-19, the virus actually weakened our immune system. It seems to be pointing that way. So that's why we're seeing more severe cases of infection, and that there's a risk of, there's no vaccine for RSV, and that there's a risk for hospitalization and for more complications or more severe illness if you don't have your up-to-date COVID-19 vaccine and the flu vaccine. So that's kind of what the message that we're working on. And we're trying to promote both and letting people know, hey, you can get both at the same time. We do get some people that reject us because they say they don't want to feel bad or they don't want to get the flu. That's definitely something that we hear a lot, that they think that if they get the vaccine, they're going to get, for some reason, I think they're also going to get the infection. But that's kind of what we've been trying to do, even though, again, we're not having our pop-ups as aggressive and we're close to wrapping up data collection. We're still working on providing resources and informing the community about that. But I don't have any other ideas. What I think that could probably work is having more comprehensive care and more, so through these, as I mentioned, through these community pop-up clinics, still having that health education and literacy component centered on either the flu, like why should you get the vaccine, who would be at risk, what happens if you don't get it, and building on the momentum of what we've been doing right now, I think would be useful. I mean, there's also a lot of hesitancy against, especially among Latino and Black parents, on having their children getting HPV. So that's the HPV vaccine. So that's something also that we're kind of thinking in the background. How can we move with similar efforts to really try to increase the uptake? But I'll open it up to anybody else who has any other ideas. But for now, at least that's what we're trying to do. And we are asking if folks have gotten the flu vaccine and if they actually follow the recommendations given by their provider, if they have a provider that they see on a regular basis. I think that's the other problem. A lot of people are not really in care or don't have access to care. Sorry, I just went around. I can talk forever.
Is San Ysidro House, is that a community health clinic or is that just a healthcare organization?
It's a federally qualified health center that's pretty well known in Southeast San Diego. So it was really great to partner with them because, I mean, we had people come up to us and say, yeah, we know we can get the vaccine anywhere, but we prefer you because we know you.
And is there something similar?
That.
Is there something similar in the African American community? Or not quite?
Well, no, well, San Ysidro has expanded. So it was kind of like a win-win partnership because now they're all the way up to Julian Santee, Campo. Now they're across and they have those clinics. So they bought out a couple of clinics in Valencia Park, Lincoln Park, that are more historically Black communities. So it was really great to have that partnership with them because they were all kind of already trusted in the community.
Wow. Well, I mean, this has been a great discussion and a wonderful presentation, and thank you so much for your time today. We really appreciate it. David, did you have anything else to say, or I'll introduce the next speaker for January?
Oh, we're good. Thanks. Still go for it.
And thank you to David. Sorry, Davey, for being so supportive and telling me what could work and what couldn't work and allowing for this work to happen too. So he was also a lot of behind the scenes.
Thank you.
All right, everyone. So thanks again to Dr. Servin for our last presentation of 2022. Please join us in 2023 on January 13th when we'll have Dr. Sumit Chanda speaking from 1 to 2 p.m. And invitations will be coming out in the coming weeks. So thank you all for attending today. We really appreciate it, and we'll see you next year.